With Baptist Health continues now with an interesting segment. We're going to call it Fact or Fiction. The regular viewers of this program may remember Dr. Richard Wyatt. Good to see you.
Hi, Steve. Good
How you doing?
See you. I'm fine.
Who's birthing all the babies while you're here with us right now?
Well, they're just kind of on hold right now, so
okay, we better go fast.
Hope they wait. Yeah,
exactly. Well, thank you for doing this.
Thank you.
There are a lot of things you hear as an expectant mother. Some are true and some aren't.
That's true. You're right.
Let's get to the bottom of about a half dozen of these.
All right.
Let's begin with fact or myth number one. Is it okay to take ibuprofen during pregnancy? Now, ibuprofen is the generic name for Advil, is that?
Motrin, Advil,
okay.
Yes, and that would be fiction.
Fiction?
Yes, yes. Those drugs, aspirin-like drugs, are not used during pregnancy. The go-to drug for pain relief or headache relief would be Tylenol.
Tylenol. So
yeah.
Stick with the Tylenol.
Yeah, away from ibuprofen.
All right, sounds good. All right, fact or fiction number two. All women need the same amount of calcium.
That would be fiction. The younger ladies, 13 and under, pregnant and lactating women, and postmenopausal women actually need more calcium than the women of childbearing age. So it kind of varies depending on age and if you're pregnant or lactating. And most of those women would need 1,800 milligrams of calcium. The ladies in their 20s and 30s, probably 1,000, 1,200 milligrams of calcium. So
best to let your doctor be your guide on something like that anyhow.
Correct.
All right, let's go to fact or fiction number three. This is one I've heard many times before. Cat litter is linked to certain birth defects, and I thought this surely must be fiction.
No, that's fact.
It's a fact.
That's fact, yeah. And actually, I'm not sure about the litter itself.
That's what's in the litter box.
It's what's in the litter box. Outside cats can eat rats or whatever, and they can get infected with a parasite that actually, if a pregnant woman gets that infection, could be bad for her baby. So pregnant women, let your husbands change the litter box.
Change the litter box. And maybe would it be to quarantine the cat in the cat box to another part of the house? Would that be?
Yeah, or another house or county or, yeah. No,
or to convert your inside cat to an outside cat and hope for the best.
Yeah.
All right, fact or fiction one more time. Breastfed babies have fewer ear infections. Now, there's an interesting concept. Fact or fiction?
That's true.
Really?
True. The phrase I use is breast is best. And one of the facts of breastfeeding is that all sorts of infections are less in those babies. Ear infections, infectious diarrhea, most simple colds, flus, viruses, and the like are going to be decreased if a baby's breastfed.
So let me understand, it has really less to do with the ear than it just does to have the baby's ability to fight infection, period?
Yes, I think so.
Okay.
Correct.
Yeah, that's very interesting. All right, let's move on to another fact or fiction. The baby blues is an intense feeling of letdown that affects about 25% of all women in the first few weeks after the baby is born. Is this what we refer to as postpartum depression? Same thing? No?
Baby blues, and the answer to that question is that is fiction.
Fiction, okay.
It's much more common than that. Probably estimates of up to 75% of women have a letdown, have the baby blues. Now, the postpartum depression...
Is that different?
That's different. That's more serious, which might even require medical intervention. Probably is down there around 25% or so. Right, but most women do have somewhat of the baby blues, I think.
And that's more chemical in nature than anything else? Or
it's just a combination of sleep deprivation.
Right.
You have a 1-year-old,
yes, right.
So you know what that's like. Change in their body, hormones, there's lots of reasons for that. So.
And if it gets so bad, would they go back to the doctor? Can you do something for them? Would you?
We treat a lot of postpartum depression. We really do, and even occasionally we would have to refer those women to a mental health specialist, yes.
Yeah, be very serious in some cases. All right,
yes.
The final fact or fiction question is this. Newborn babies will use more than 200 diapers within the first month.
Well, can you answer that better than me?
That's got to be. It seems like fact. I know that.
I think at least that many.
Yeah.
So, newborn babies use a lot of diapers. So, really, anybody out there pregnant right now needs to tank up on diapers before they bring their baby home.
Exactly. So, ask for everybody who comes to the shower to get you diapers.
That's an easy one, isn't it?
For sure. Yes, you should. Yes. If you're not changing 200 diapers, you probably aren't changing them enough.
That's correct.
Dr. Richard Wright, thanks so much. Hey, let me remind folks about this terrific Healthy Baby, Happy Birthday Baby book, which you can get by dialing the number you see on your screen there, 1-888-BAPTIST, or there's a toll-free number there on the bottom of your screen, 1-800-235-0002. I know you wholeheartedly recommend this to all your patients, don't you?
Really do. It's full of really good services and products in there, so it's some good discounts.
Probably some coupons on some diapers if I
think you're right. Yeah.
You're going to need.
Yeah.
Let's see, 200 a month, 200 times 12. Well, I'm not a mathematician, but that's a bunch of diapers.
It is, right.
Dr. White, great to see you again.
You too,
See you
Steve.
soon.
Thank you.
All right. Going to take a break. When we come back, got some news headlines for you. Stay with us.